system, focusing on disease on womb, uterus, and ovary. Yeah, next please. Next, we talk about the disclaimer. We have disclaimer. So all this information that we share in this, all this slide are actually intended for general health, okay, information and educational purposes only, and are not intended to be used as a substitute for professional medical advice, treatment, or care. Yeah. Yeah. Next. Okay, first we look at the female productive system in terms of the function. So the function are to produce the female egg cell necessary for the reproduction. The eggs also called ovum or oocyte. So another function is to actually transport the eggs. Okay, the eggs actually to the site of fertilization. Okay, so the site of fertilization is so-called in another area. So they have to transport the eggs to that area. The next is the conception. So in order for conception to take place, the fertilization of egg must be actually by a sperm. So the sperm must actually meet the egg and enter to the egg. So they actually happen in the fallopian tubes. Yeah. So once this fertilized egg is fertilized, they actually have to go to another stage. They actually have to move to to a place where they can actually implant it into the wall. So that place is the uterus. Yeah. So that actually start the beginning of the initial stage of the pregnancy. Yeah. So what happens if fertilization doesn't take place? Okay. So the system, okay, will actually designed to actually mattress it. So this is the monthly shedding of the uterine lining, so-called the period. Yeah. So this one all will be passed out from the body. So another function is to produce female sex hormone. Yeah. So for example, that maintain the reproductive, also the maintain the reproductive cycle. So the because of this hormone is to regulate the reproductive, to support the overall reproductive health. Yeah. So next we'll look at the female anatomy, in terms of the internal reproductive organ. So we start off the ovary. So the ovary are small, oval-shaped gland, and there are two. They are located on either side of the uterus. They have two main functions. Okay, just now I mentioned about. First, they have to produce an egg, and another function is that they actually secrete the female hormones, estrogen and progesterone. Next is the fallopian tubes. So this is the place. This fallopian tube, narrow tube, attached to the upper part of the uterus. So they act as a tunnel for the egg to travel from the ovaries to the uterus. So for conception to take place, or fertilization of an egg by sperm. So usually the sperm have to swim all the way to this place, and the egg will come down and they meet, and eventually they can actually fertilize the egg. Then once the fertilized egg then moves to the uterus to implant into a uterine lining. So next is a uterus, where the fertilized uterus is a narrow pear-shaped organ that serves as the home for the developing fetus in the baby. It is divided into two parts: the cervix, the lower part of the opening into the vagina, and corpus, the main body of the uterus, which actually can expand to accommodate the growing baby. And the last is the vagina. So the vagina is a canal that actually connect the cervix and the lower part of the uterus and to the outside of the body. So it also known as the birth canal, as it is the passageway through which a baby is delivered during the childbirth. Yeah. Next, we look at the menstrual cycle. Okay. So menstrual cycle is a vital process in the female reproductive system. This cycle prepare a woman's body for potential pregnancy each month. Okay, it actually prepare for it. Okay, doesn't mean that it's pregnant, but it's potential pregnancy during this time. Yeah. So menstruation is the shedding of the uterine lining. So this happens every month. So typically it follow a 28-day cycle during which a woman's body prepare for potential pregnancy. Yeah. So menstrual bleeding may actually happen every 21 to 35 days. Okay, and last about 2 to 7 days. So for this cycle, menstrual cycle can be broken down into three phases. First is the follicle phase. So in the follicle phase, the body actually prepare an egg cell. They are preparing the egg cell to reach maturity. So this phase begin on the first day of menstruation and continue until ovulation. Yeah. So second phase is the ovulatory phase. So the ovulatory phase involves the release of this mature egg cell from the ovary. So usually it occur around middle of the cycle. Yeah. So the last phase is the luteal phase. So during the luteal phase, the body prepare for a possible pregnancy. Okay. So the lining of the uterus will start to get thicker in order to support the fertilized egg. Yeah. So during these three phases, there are four hormones involved. Yeah. So the first two hormones, follicle stimulating hormone and luteinizing hormone, these two hormones they are actually releasing from the brain, okay, pituitary gland. So these two actually send it to ovary to produce the egg, to get it mature and then to release the egg. So these are the two main functions of this hormone. And for estrogen and progesterone are actually released by the ovary. Yeah. So progesterone, in fact, is to further. Before I talk about progesterone, actually the first one is the estrogen. So estrogen will actually help to regulate the menstrual cycle and start to thicken, okay, the uterine lining during the follicle phase, which is during the so-called before the egg get mature. So they already start to actually regulate and thicken the uterine lining. Then the next phase is the progesterone will actually further thicker once the mature egg is actually released, and then they will thicken the lining during the luteal phase. In fact, during this time, progesterone is preparing for a potential implantation of the fertilized egg. Okay, yeah. So next we'll look at estrogen. Yeah, the function of progesterone. Okay, so after an egg is released from the ovary, progesterone help to prepare the uterus, okay, for possible pregnancy by maintaining the uterine lining. So what happens if the egg is not fertilized? Okay, meaning there is no sperm involved. Okay, so the progesterone level will drop. So this decrease the shedding of the uterine lining. So the uterine lining will stop, thickening, and they will actually start the shedding. Okay, so leading to menstruation, okay, which means the period. Okay, they will start to bleed away all this to break down the so-called the lining layer. And progesterone also decrease the number of estrogen receptor in a certain tissue. So that means this tissue become less responsive to estrogen. Yeah. For example, after breasts have fully developed during the puberty, progesterone actually help to limit further growth of the breast cell, balancing the effect of the estrogen. Yeah. So stimulating bone formation. So osteoblasts are cells responsible for forming the new bone. So progesterone stimulates this cell, promoting the replacement of old bone with a healthy bone. So this helps to maintain the bone density and the strength. So they are quite important in the bone health. And thyroid binding globin. So this is a protein that actually bind thyroid hormone, so affecting the activity. So progesterone reduces the level of this protein, which can actually influence how the body uses the energy. Yeah. And next is by affecting this protein, progesterone actually help the body utilize fat stored under the influence of the progesterone for energy. So if progesterone level are too low, this process is less efficient. So potentially leading to a weight gain. Yeah. So next is a progesterone can actually convert it to testosterone, a hormone that stimulates sex drive, and it also affect the brain. So progesterone has calming effect on the brain. It can help reduce anxiety and improve sleep by decreasing the insomnia, and also by influencing neurotransmitter, okay, for mental health. So progesterone can help alleviate symptoms of depression, contributing to a better overall mental health. Yeah. So next, we will look at the reproductive system disease. Okay, in terms of their about about 70%, 80% of women will actually develop uh, uterine fibroid by the age of 50. So it's quite common for women to have this so-called fibroid and cyst or cysts. So they are non-cancerous. The only problem is that their growth can vary in size and in different location in the ovaries and uterus area, often causing symptoms like heavy menstrual bleeding and pelvic pain. So when it comes to treatment, fibroid can be removed by surgery. However, there is a chance they can grow back. So based on the past statistic, for those who had a single fibroid removed, about 11% of patients will actually require repeat surgery within the next 10 years because it grew back. Yeah, the rate increased to approximately 25% for those who had multiple fibroid removed. Yeah, so endometriosis in Singapore. So endometriosis is another condition affecting women's reproductive health. In Singapore, about 1% of women, or approximately 40,000 individuals suffer from this condition. So endometriosis occurs when tissue, grow outside the uterus, so leading to a severe pain and fertility issue. Yeah. Okay. So next we look at ovarian ovarian cysts. Yeah. So there are two types of functional cysts. Okay, this ovarian cyst. Now we look at the functional cysts. Okay, which is follicle cyst and corpus luteum cyst. Okay, follicle cyst during a woman menstrual cycle, and egg actually grow inside in a sac called follicle. Okay, so this sac is actually located inside the ovary. Yeah, so in most cases, this follicle actually break open, and release an egg. But if the follicle doesn't break open, the fluid inside the follicle can form a cyst on the ovary. So as for Corpus luteum cyst, follicle sac typically it start off with follicle sac, typically dissolve, after it releasing the egg, But if the sac doesn't dissolve, and the opening of the follicle seal, does dissolve and left the opening of the follicle seals, additional fluid can actually develop inside the sac. And this accumulation of fluid causes Corpus luteum cyst. Yeah, so in summary, these are the condition where egg-producing follicles, swell with fluid. Usually harmless, and it will disappear after a while. Yeah. So continue next. Ovarian. If you look at other type of ovarian cyst, yeah. So it's the ovarian demoid cyst. So these are sac-like. It's also a sac-like grow on the ovaries, and this one contain hairs, fats, and other tissue. Why? Because these demoid cysts are from germ cells. So these germ cells that eventually actually become an egg or sperm cell. So germ cell can actually grow, develop into tissue, organs, and body system during the so-called fetal development, which is for baby, the early stage for the baby development. Yeah, they can grow large, causing the ovary to move out of position and lead to pain. Yeah. Next is the ovarian cystadenomas. It's also a non-cancerous type, but it grows on the outer surface of the ovary, and it's also fluid-filled cyst. Yeah. And another one is the ovarian endometriomas. So this cysts form when tissue that usually grow inside the uterus, inside the uterus, grow outside and attach to the ovary. So they are filled with a dark chocolate liquid. Yeah. So they made up about 15% of all ovarian cysts. Yeah. So the next one is the PCOS, polycystic ovarian syndrome. So this is a condition where ovarian contain a large number, okay, a lot of small cysts and it actually grow and become larger. Okay, it is a tiny fluid filled follicle. Yeah. Mm. So in summary, demoid cysts and cystadenomas can grow large and cause pain by moving the ovary out of position. Endometriomas are associated with the endometriosis and can be painful. So PCOS involve multiple cysts and can have broader health implications. Yeah. So next, we look at the symptom, complication, and causes. Yeah. So the symptom of ovarian cyst, yeah, is pelvic pain, yeah, and discomfort and pain in the lower abdominal, and feel also fullness and heaviness in your abdominal. So most time abdominal will feel pain, and complication of this from this ovarian cyst, okay, ovarian torsion. So in fact, ovarian torsion means that the twisting of the ovary, okay, which can actually cut off its supply and cause severe pain. Why it got twisted? Because when this so-called cyst grow larger and bigger, and you start to grow in different directions, so it start to twist. Yeah. So this is a medical emergency because if the blood supply is cut off long enough, the ovary no longer be able to do its normal work, which can actually impact fertility and cause other problem. Yeah. So a cyst can burst, leading to internal bleeding and cause the sharp and sudden pain. So the worst condition is the ovarian to become an ovarian cancer. So where most cysts are benign, okay, which is non-cancerous, but there is a high risk of ovarian cancer in the post-menopausal women. So causes vary because functional cysts are actually related to menstrual cycle, while other type often unknown. Okay, so important to identify all these symptoms and go and get them checked as soon as possible if you do feel some of these symptoms. So especially if you have abdominal and pelvic pain. Yeah. So next we look at the fibroid, uterine fibroid. So uterine fibroid are generally non-cancerous tumor, okay, which only 0.2% become cancerous. Yeah. So there are different type of these fibroid, depending on the location they are found. So first one is intramural fibroid. So this fibroid actually grow in the muscular wall of the uterus. So this is the most common type of fibroid and can cause symptoms such as heavy menstrual bleeding, pelvic pain, and pressure over the area. Second one is the submucosa fibroid. So this actually can be found in the inner wall of the uterus. Okay, and less common but can cause severe symptoms, and it can lead to heavy menstrual bleeding and a prolonged period and reproductive issue. Okay, next is a subserous fibroid. So this fibroid actually grow from the outer wall of the uterus into the space outside the womb. Okay, they can grow large and cause pressure on the surrounding organ. Okay, may lead to symptoms such as back pain, bladder issue, and constipation. Yeah, so in summary, okay, intramural fibroid are the most common and grow within the muscular wall of uterus, as for submucosal fibroid grow from the inner wall of the uterus in causing significant symptom. Serous fibroid actually grow from the outside wall of the uterus, so often impacting surrounding organ. Yeah. Okay, so next we will look at the symptom and complication and causes. Okay, uterine fibroid are non-cancerous, grow in the uterus. So their symptom can vary based on their location and size. Some common symptoms include heavy menstrual bleeding, pelvic pressure or pain, yeah, and the complication there are few. Anemia. You may actually feel anemia because heavy blood loss from the fibroid can cause anemia. So this is a condition where you don't have enough healthy red blood cell. Okay, this anemia, and you also can have the complication of infertility and the pregnancy loss. So especially for submucosal fibroid, because why? Because it actually grow into the inner cavity of the uterus. Okay, it can interfere with pregnancy, causing infertility or pregnancy loss. So that is a place where actually the growth of the so-called baby start. Yeah, so that's why it affect the infertility. And the exact cause of a uterine fibroid still not known, but several factors contribute to the development. Genetic change is what they believe. Genetic changes in certain gene can lead to a growth of fibroid, and also another one is associated with hormone. If estrogen level is too high, they can lead to fibroid development and growth. Okay, but if you don't have sufficient progesterone, the body can't stop the growth. So it all related to the hormone imbalance. Yeah. So others factor is there are substance like insulin like growth factor can also contribute to a fibroid development because it's it stimulates cell proliferation in the uterine fibroid tissue. Yeah. So in summary, uterine fibroid are common and can cause symptoms like heavy bleeding and pelvic pain. And this can lead to complications such as anemia and fertility issue. So understanding the cause, including genetic changes, hormones, and growth factor, can actually help in managing and treating this condition. Yeah. So next we look at the causes. Okay, uterine polyp can cause various symptoms, okay, including irregular vaginal bleeding, bleeding after, okay, irregular vaginal bleeding means bleeding that occur outside of your regular menstrual cycle. Yeah. Next is bleeding after sexual intercourse, heavy menstrual bleeding. Yeah. So the complication will be they actually can lead to serious complication such as the infertility, difficult to get pregnant, or increased risk of pregnancy, miscarriage. So there are researchers do not know why polyp form, but hormone level may be a factor. So hormone estrogen might play a role in promoting their growth because they are estrogen sensitive. A certain factor can increase the risk of developing uterine polyps, okay, being perimenopausal or postmenopausal. So because why during this time hormone changes, yeah, contribute to the polyp growth. Yeah. The level of estrogen in the body actually rise and fall unevenly during a pregnancy. Yeah. So another thing is that high blood pressure and obesity. So both conditions are actually linked to higher risk of polyps. Next is the Western drug is taking tamoxifen. So this drug therapy actually is meant for breast cancer, but they can increase the risk of developing uterine polyps. Yeah. So in summary, uterine polyps can cause irregular bleeding and lead to complications like infertility and miscarriage. They grow in response to estrogen, okay, and the risk factor include being perimenopausal and postmenopausal, and also those with high blood pressure, and their obesity, and also the next one is the taking tamoxifen drug. Yeah. Yes. So yeah. So next is looking at now we look at the endometriosis. Endometrial mitral tissue consists of gland, blood cell, and connecting tissue. So it actually grows inside the uterus and prepare the womb lining for ovulation. So while it has a low possibility of turning cancerous, it plays a crucial role in the menstrual cycle. So what is endometriosis? Endometriosis occurs when actually endometrial tissue actually grow outside of the uterus. So this build-up can appear in various locations in the body. So normally endometrial tissue is expelled, okay, during the menstruation. Yeah, but some of the tissue display cannot be expelled and still remain in the body. Yeah. So endometriosis can affect several areas, okay, including ovarian. Okay, this is a more frequent location that endometrial tissue build up. And next is the fallopian tube. So yeah, fallopian tube is the tube that actually connecting the ovaries to the uterus. Yeah. The other one is a peritoneum. So this is the lining of the so-called abdominal cavity. So this is the lining that actually can have uh, endometrial growth also. So peritoneum is actually is a membrane lining. Okay, it's a membrane lining the wall of your abdominal and the pelvis cavity. Yeah. So the next one is a lymph node. So this can also be the site for endometrial tissue buildup. Yeah. So in summary, endometriosis is a condition where endometrial tissue actually grow outside the uterus, affecting area like ovaries, fallopian tubes, peritoneum, and the lymph nodes. So this tissue, unlike normal endometrial tissue, is not expelled during the menstruation. Yeah. So it's supposed to expel, but some stay and it become this problem. So next, we look at the symptom, complication, and cause for endometriosis. Endometriosis can cause a painful period, okay, pain with intercourse, and pain with bowel movement or urination. And the complication they have is infertility, meaning difficulty in getting pregnant, okay, and cause several causes. The first one is the retrograde menstruation, so meaning menstrual blood, okay, supposed to flow out of body, but instead they actually flow back through the fallopian tube, okay. So this is the one of the problem, and the other one is the transformation of peritoneal cell. So hormone or human factor cause cell in the abdominal lining to turn into endometrial tissue. So another cause is that the transformation of embryonic cell. So estrogen can actually cause embryonic cell to actually transform into endometrial-like cell. So this so-called embryonic cell is the early stage of the embryo cell. Yeah. So the next is the immune system disorder. So the immune system actually fail to recognize and destroy the endometrial tissue growing outside the uterus. So in summary, endometriosis causes painful symptoms, can lead to infertility and a higher risk of ovarian cancer. So it can result, okay, from retrograde menstruation, cell transformation, and immune system disorder. Yeah. So next, we look at the treatment option. Yeah. So sometimes this condition might resolve on their own, okay, without any treatment. So specialists will actually decide whether it is better to wait for it to disappear or consider a surgical treatment. Yeah. So the first one is a watch. That's why we have a watchful waiting, because sometimes a period of time they do observation, they found that it actually grows smaller and then it go away. Yeah. Most of the cysts will have this characteristic. And next, okay, they will have birth control pill or hormone therapy. So the whole idea of this birth control and hormone therapy is to stop the ovulation and slow the endometrial tissue growth, and also control and the growth of the endometrial tissue. Okay, but these are not the permanent fix for endometriosis. Yeah. Third is the control and lessen symptom of the uterine fibroid and polyps. So they will use drug called gonadotropin releasing hormone agonist. So this drug actually block the production of estrogen and progesterone to actually shrink the fibroid and polyps. So another one is the progestin releasing IUD. So this IUD is a device. Okay, this device actually is inserted into the uterus area, and they are supposed to release progestin. Okay, and it's a synthetic form of a progesterone. So this will actually help to relieve the heavy bleeding, menstrual bleeding. Yeah. Lastly is for stopping the heavy menstrual bleeding, doctor actually may use another drug, okay, called tranexamic, okay, tranexamic acid. So this medication actually help to ease the heavy menstrual period, and is taking only on heavy bleeding day. Yeah. So in summary, treatment range from watchful waiting okay, to various medication that actually stop ovulation, control symptom, and reduce heavy bleeding. So each option help manage this condition differently. Yeah. So next, we look at surgery. Okay. So another treatment option is surgery to remove the cyst. Okay, first remove ovarian cyst. They will use the laparoscopy. Okay, for small cyst, a small instrument is inserted through the navel. So for larger cyst, a larger incision in the abdominal is made. So if a cyst is cancerous, a hysterectomy, okay, may be performed. So hysterectomy is to removal of the ovaries and uterus. Yeah. So laparoscopy is a surgical. It is a This is a surgical procedure commonly used to actually visualize and examine the organ inside the abdominal and diagnose and treat a number of medical conditions. And this is the minimally invasive procedure. Yeah. So they actually this one the laparoscope is actually used to look at the abdominal organ through a screen. Yeah. Second, remove the uterine fibroid. So first one is the hysterectomy. So hysterectomy is the removal of the whole uterus. Then the other one, another term is called myomectomy. So myomectomy is only selective remove, okay, of fibroid with the intention of keeping the uterus. Yeah. So third, okay, remove uterine polyps. Okay. So polyps are actually removed during a hysteroscopy, and then they do a biopsy and remove endometriosis. So remove area of endometriosis either through laparoscopy, through convention or through a conventional abdominal surgery. So for severe case, they actually may require a hysterectomy. So hysterectomy, just I mentioned, is to remove the whole of the uterus and cervix. Yeah. So in summary, surgical option vary based on the condition and its severity. So ranging from minimally invasive procedure to a more extensive surgery. Yeah. So next we look at the hormone imbalance. Um, these two hormones, estrogen and progesterone, play a major role in affecting women's health. Yeah, especially they are at the imbalance stage. Okay, first you look at is the estrogen dominance. Okay, meaning more estrogen as compared with progesterone. They actually cause the growth. Okay, the effect is that actually they cause the growth of the uterine fibroid and polyps. Okay, this happen without the balancing effect of progesterone. Okay, then they need sufficient progesterone to actually stop the growth of fibroid. Yeah. So second is a deficiency of the progesterone. Yeah. The the effect is that the common cause of this so-called PCOS. Okay. That due to a irregular and absent ovulation because of deficiency of progesterone. Yeah, and this lead to a condition called luteum phase defect, where inadequate level of progesterone are produced during the second half of the menstrual cycle. Yeah, third is the hormone imbalance. Yeah, so hormone imbalance that can actually lead to a condition like endometriosis. So um, because during puberty, pregnancy, or menopause, imbalance can cause endometrial tissue to grow faster or slower. Yeah. So in summary, maintaining a balance between estrogen and progesterone is crucial. Actually, it's important to actually prevent conditions such as fibroid, polyp, PCOS, and the endometriosis. Yeah. Okay, next we look at the endometriosis and immune system. Okay, so endometriosis is a major cause of, by just now we mentioned by the backflow, okay, of menstrual blood spill out of the fallopian tube, which is called a retrograde flow. Yeah, so menstrual blood actually flow back, okay, spill out of the fallopian tube and actually implanting all the tubes, ovary, and other area. So many women actually experience this backflow, but only 1 in 10 develop endometriosis. So the difference lies in the immune system. Yeah. So what does the immune system role in this? Yeah. First, the immune system should actually destroy all this backflow tissue, okay, before it actually takes hold and grow. So NK cell, the first one is this NK cell supposed to keep tumors and normal cell in check by releasing those toxins to kill them. But having high level of estrogen, okay, will lead to will actually suppress the NK cell activity. That's why they actually reduce their effectiveness. Another one is a macrophage. So this cell attack and consume a foreign cell like a virus and bacteria. But however, this can trigger inflammation that leading to the formation of endometriosis cell. Yeah. So in summary, endometriosis is influenced by the immune system ability to manage the so-called backflow menstrual to the so-called the fallopian tube, and this and so-called the immune system is supposed to manage this and destroy all these abnormal cell. And high level of estrogen level can actually impair immune function and contributing to the development of this endometriosis. Yeah. Next, we look at the in TCM perspective. Yeah. So in TCM perspective, okay, we look at the function of liver because the liver maintains an unobstructed flow of qi and blood throughout the body. Yeah. So the liver is responsible for actually storing blood to make sure that enough blood available and as and when the body needs it. So if the liver cannot properly store blood, and it can cause irregular actually menstruation, painful period, or even absence of the menstruation. So in summary, according to TCM, the liver plays a very critical role, important role in regulating the flow of qi and blood and in storing blood. So deficiency of this order in this function can lead to menstrual issue. Yeah. Next, we look at Linzer supplement. Yeah. So Linzer, or so-called in scientific term called Ganoderma, okay, they are being used for food supplement, and they can help in women's health. It has been recognized as the medicinal mushroom for over 2000 years, and its powerful effect had been actually documented in two oldest medical books in ancient China, 神农本草 and 本草纲目. So in the last 50 years of modern scientific research in Linzi, we can actually find a lot of evidence-based reports being published. We can easily get more than 1,000 results on the internet using the keyword search of Linzi or Ganoderma and diseases. This will actually show up all your research paper published, and almost all the reports can be found in PubMed website, which is the US National Library of Medicine. Yeah. So if you are interested, you can actually Google it. Next, we look at the supplement from shop. Focusing on the woman's health. Yeah. The first one is a regulate immune system. It enhance and balance natural killer cell and macrophage. Yeah, we reduce the chances of developing endometriosis. So as mentioned just now, that is one of the causes by the backflow of the menstrual blood, the spill out of fallopian tube. This can actually help. Yeah. So second is improved blood circulation. So it helps lower cholesterol and triglyceride and reduce the risk of cysts because it actually can lower the blood glucose. Yeah. And decrease the risk of developing fibroid. Yeah. So this because it can actually prevent obesity. Next function of linzer is that enhance the liver function. So it actually taking this linzer can actually help the liver detoxify your body and help to regulate the estrogen in the body. So liver actually deactivate the estrogen before it's eliminated. So when active estrogen completed their function, they must actually secreted out of the body. So this is done by metabolized by the liver. So if this is not done, it's not secreted out of the body, estrogen is still stay inside. After they do the job, they still stay inside our body. Estrogen level will be high in the blood circulation. Yeah. So the benefit is that taking linzer will actually prevent high level of circulating estrogen. Yeah. That actually cause the fibroid and polyp growth. Yeah, consuming linzer also help to remove the free radical and provide antioxidant effect. Yeah. So in summary, linzer support women's health by actually regulating the immune system, improve blood circulation, and reducing the risk of endometriosis, cysts, and fibroid. Yeah. And in addition, consuming linzer can actually help in enhancing the liver function, regulating the estrogen level, and act as a natural antioxidant. So this actually benefit help manage fibroid, cyst, and endometriosis symptom. Next, you look at the dosage. So the recommended dosage will be for prevention. Dosage is 4 to 8 capsules, okay, of YK Ganoderma daily. This actually help to regulate hormone level and reduce the side effect of the Western medication. And you can actually increase up to 12 capsules of YK Ganoderma and above, okay, for daily consumption. Okay, this is considered as therapeutic and mega dose effect. This will help to regulate hormone level. And we can also increase further to 30 capsules of YK Ganoderma above for daily consumption. So the benefit is that this for serious, they actually help in a serious condition involving multiple types of cysts, fibroid, polyp growing. Yeah. So in summary, the dosage of YK Ganoderma varies based on the purpose. Yeah, from prevention and reducing drug side effect to therapeutic use for the regulating hormone and addressing some of the serious condition. Yeah. Next, you look at the Yonkin pollen, another supplement from Shanghai. So this Yonkin pollen is one of our quality product. Okay, is having more than 16 vitamin, more than 16 mineral, and having a 21 amino acid and 28 nucleic acid, and have more than 94 enzyme and coenzyme. So this so-called nutrition treasure, okay, demonstrate impressive. Okay, they actually have impressive effect on calm our nerve. Okay, can regulate our nutritional imbalance. Okay, and help also in the weight loss. So in terms of energy, it also help to increase our stamina and remove fatigue. So in summary, Yonkin pollen offer a comprehensive area of nutrients and therapeutic benefit to actually support women health and vitality. Yeah. So next, we look at another quality product. It's a Jaho instant soya protein powder. So this protein product has actually have a score of a PDC AAS score of 1. Okay, some of the product you see in the market also have this score. So what is this PDC AAS? Okay, stand for? They actually stand for protein digestibility corrected amino acid score. This is a method actually is a method to actually to evaluate the quality of protein based on both the amino acid requirement for human and their ability to digest it. Yeah, so score of 1 means it's the best quality protein that the body can fully use. So the range is 0 is the lowest, 1 is the highest. Yeah, so they have this so-called unique formulation. So it contains isolated soya protein, lecithin, papain, and the so-called the pineapple enzyme. So the body can actually absorb up to 95% of all this protein. So ensure that there is no wastage. So the key component is the isolated soya protein. It helps to subdue the growth of tumor cell and for cancer, to prevent cancer. And lecithin actually prevent the cancer disease. So lecithin, another component, is to reduce. They actually help to reduce excessive fat in the blood vessel and the liver, and also help in the weight loss, and encourage brain development and help prevent Alzheimer's disease. So another 2 components is a papaya enzyme and the pineapple enzyme. So this one actually help in digestion to actually help the body assimilate protein more easily. So in summary, Jaho, so-called this Jaho instant soya protein powder offer a high quality protein, actually promote overall health and support digestion and brain function. Yeah. So next we look at another product. Okay. So this product is for supporting gut health and strengthen the immune system. So this lactoberry induce actually microbial balance and provide a boost to immune system. And the benefit is that they help to have a good bacteria to grow, prevent bad bacteria from growing, and lower the risk of colon cancer, and help to improve eczema and allergies. Yeah. So in summary, lactoberry help maintain a healthy gut, support good bacteria, and reduce the risk of infection and allergic reaction. Yeah. Next, we look at the testimonial. Okay. This testimonial is from Singapore. A lady aged 30 back in 2005 diagnosed with a 1 cm ovarian demoid cyst from an ultra scan. So doctor asked to have 6 months under observation and to be reviewed on December 2005. That is a 6-month time. So no Western medication being prescribed for her. She started daily consumption of 15 to 20 capsule of linzi together with 30-40 capsule of bee pollen, for 6 months. So on the first review, after 6 months, on the first review, the report showed that the demoid cysts are still there, but the one thing is that they are not growing and stay at 1.9 cm in size. Yeah, so doctor saying that schedule another review in the next 6 months on July 2006. She continued the same dosage for linzi and bee pollen. So on the second review, after 6 months, on the second review, ultrasound results show no ovarian cysts found. Yeah. So here are some of the report in this presentation slide. you can actually take a look. And another very good news is after 6 months of the second review in October 2007, she got pregnant. Yeah. So this is another good news. So next we look at another testimonial. Okay. So this testimonial, the second testimonial is from Taiwan. Okay, Madam Chan, age 60 back in 2014. Also was diagnosed with endometriosis, chocolate cyst, okay, in early 1995. Later with a stage 0 cervical cancer. So after radiotherapy, doctor actually suggested remove her uterus, but she decided not to remove it first, and she actually chose to take Ganoderma lucidum instead of undergo surgery. Yeah. So she can't recall the dosage. What she can actually remember was she had increased the dosage. Yeah. So when they start increasing after increasing the dosage, she actually experienced severe backache. Okay, that's a vertical reaction. 1 month later, her uterus was found to be completely normal, with no need for further treatment. So her ovarian cyst tumor 5 cm on the right, 3 cm on the left disappear. Yeah, after taking the high dosage of Lingzi. So another discovery was that her inner ear imbalance problem also recovered. And after that, her menstrual stopped at age 50. Okay, in fact, her menstrual stopped at age 50. Yeah, she managed her menopause symptom successfully. So this testimonial actually highlight the key aspect of Madam Chan's health journey and her experience with Ganoderma Lingzi. Yeah. So next, go to a conclusion. So women often prioritize their family health over their own, and taking care of husband, children, and parents. So it is important for a woman to monitor their own health due to their significant family responsibilities. So let's start get Ganoderma or Lingzi product help to take care of women's health. So with that, I end my presentation. Thank you.